Herb Rose, question for Dr. Kogan.
Sorry, can you repeat your name, please?
Herb Rose. Your studies have dealt with the United States. I lived for a period of time in Europe some years ago, and maybe I'm being too presumptuous. I don't know whether Europeans use as many personal care products as Americans do. Do you have any evidence that there is a difference between the effects of personal care products in the United States versus Europe? Or for that matter, any other part of the world?
Right. That's a great question. In that's still an open research question, one of the ones that we're trying to understand further. And we are working with colleagues in London, for example. They've made similar urban measurements using PTR TOFs and these GC measurements to try and answer that question. But there is evidence to say that, for example, if you look at ethanol, we think of ethanol, we dope ethanol into our fuel, yet you can't recreate ethanol concentrations in urban environments unless you include sources of VCPs, right? So the one molecule that you would expect would have a huge source from mobile sources can't be explained unless you have these. And I know the same is true in some of the countries like in Europe. Questions about what are the effects in places like China or in Asian countries. There's a lot of an industry there, so a lot of the personal care products that we use, a lot of the products that we use come from there. And so the industrial aspect may outweigh VCPs, but we could call those industrial VCPs. So it's an open question, and I think we're working with colleagues in Europe, but then also in we're hoping to open up more collaborations with people in Asia too to understand these sources.
Dustin Popnick, NIST. Heather is a fascinating, disturbing talk as usual. Have you done any data on metabolites of TCPP that's typically found in spray foam, and have you found any links to suggest any elevation in houses with spray foam?
Yeah, we do monitor the urinary metabolites of TCPP in our cohorts, and it's detected in almost every single child and adult, certainly. It's probably the most abundant organophosphate ester that we measure in the indoor environment. It's difficult to track the sources on that. It is used heavily in insulation, but it also is one of the flame retardants used in polyurethane foam. And it certainly could be used as a plasticizer as well. We did try to collect information on the insulation in all these homes. You can't really go behind the walls to collect that information, and most people actually don't know the type of insulation in their homes, so we found that was a real big barrier to for us to look at that relationship between what was in the children and what the insulation was in the home. So we could only record what we could see, so that was a big problem. But it is something, as I said, we were working with this group at Amherst where they were actually looking at the occupational exposure to TCPP in those workers, and I mean, that was the highest I've ever seen of all the work that we've ever done for several years. I mean, I had to dilute my samples down 100-fold to measure it. It was really, really unbelievable.
Thank you. We have a question that's come in through the chat. We might have several people who want to respond to that. So the question is, what efforts are being made to get this information, especially about the hazards of household materials exposure and personal care products exposure, out to the general public? Panel? Volunteers?
I'll start. I think the key question there is the hazard, right? So hazard is a measure of toxicity. There are data for some of these chemicals, but not for all of them. So what that really leads to is an evaluation of the risk. And risk is a function of exposure and hazard. And I think we need more data, I think, is what we need for many of these chemicals. Some of the flame retardants that I talked about, one of them in particular was already phased out because the risk was quite clear. But I think we have a long way to go for a lot of these other products and collect more information.
Okay. Anyone else on the panel like to take a...
Very briefly. Does it work?
You want to try this one?
All right. Thank you. Now, very briefly, just a thought about we we're only starting to learn about a lot of this. And the research is the first evidence that a problem may be present, but that doesn't mean that there is always a problem present with every chemical we study. So I think it's important to mention this very clearly, because not every chemical that we measure, particularly with the new tools that were described this morning that can measure hundreds or thousands of chemicals, doesn't mean that inhaling all of these chemicals would make us sick necessarily, obviously. So I think the next step would be to go from this more descriptive phase to maybe targeting a smaller number of chemicals and look at their toxicology. And that is by itself a huge research effort.
Thank you, Hugo. We have another question in the room.
Hi, my name is Bree Welzer. I'm coming from Green Seal. We certify products to be effective, healthier, and safer. We come from a a hazard elimination perspective. I wonder, is there any direct takeaways for the voluntary programs that are trying to recognize products? We mainly work in the cleaning product area. For how policymakers or these kind of voluntary programs can continue to push products, also the manufacturing process, the end products, and any other takeaways you had in terms of private partnerships and ways in which scientists can direct their information and their research toward these types of voluntary programs would be really helpful.
I'll take that.
Well, one thing I think that's useful for these types of partnerships is from an outdoors perspective, when we try to understand how these products can impact air quality, we're interested in building emission inventories. So we need to know for every gram of use how much pollution gets emitted into the atmosphere, and then from there we use models to try and understand how does that lead to ozone pollution. And a good partnership for us is to understand, can we get access to what's in some of these products, like how much is actually in there, and if we were to use those products, could we determine emission factors to put into these models? And so that's one big thing that is helpful for us. Is this is such a wide variety of chemicals associated with these products, and in order to start making sense of all that, we need to gather that type of information. So that's something that we can always use is like emission factor analyses.
Thanks.
Hugo, did you have something to add? No. Any more questions here in the room? Yes?
My name's Jonathan Hers. I'm with the Environmental and Energy Study Institute, and I'm an architect. And I was here at the previous conference in 2005, and it was very exciting, and I had a lot of great hope as to where we would be today. And I think we're much more knowledgeable today, but I don't really have a sense that, as similarly to the previous question, that this is going to be the tool that we've been waiting for in terms of a practical tool. And I guess this is more something hopefully we'll hear about more as this day goes on, that there are systems, rating systems out there that are making all sorts of claims about healthy environments and impacts on health, and they're moving ahead very quickly. And from presentations today, I can see that maybe they're not the most accurate, but that's what we have right now. So I know that translating the research into action is not really what scientists are the best at, but I think maybe if they're people in public health, that's what they do, and maybe you could interact a bit more with them. So I think it's exciting, but I don't want to wait another 14 years.
Linda Birnbaum, NIEHS. So I just want to reflect on the fact that at least 50% of some of the things that you're seeing are coming from personal care products, even to getting outside. And it's really kind of depressing, because if we don't start using things that don't generate a lot of this, even if we can get our tailpipe emissions to approach zero, we're still going to have lots of air pollution going on.
Yeah, I think the question is we could pose this to manufacturers is what are we adding into these products that can reduce ozone pollution but also can reduce secondary organic aerosol formation. And one of the big questions right now, one of the open questions is how do these oxygenated, you add these things that have lots of oxygens and they may not produce as much ozone for various chemical reasons, but they're really efficient at producing secondary organic aerosol. So there's a trade-off between how that works. And so, you can lower the volatility of these things so that they don't emit much, but then they become really good SOA producers. So it's a balancing act, and I think like good partnerships and good communication with industry and open dialogue will help with that. Yeah.
Thank you, Linda and Matt. That was a good way to end our session. I believe we are out of time. Thanks again, everyone.